Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic, and Campaign 2018 partner Milwaukee Journal Sentinel.
WisconsinEye coverage of the 2018 elections continues. We're at the Brown County Library in Green Bay. Dean Raasch of Pere is a Republican candidate in the 2nd Assembly District. Dean, welcome to WisconsinEye.
Thank you. I really appreciate it.
Let's talk healthcare first, because you note on your campaign website that you're a cancer survivor and say, I will find ways to make healthcare more affordable. Please explain how you, as one member of the Assembly, would do that.
Well, I think I come from this from a couple of different standpoints. Number one, as you mentioned, I am a cancer survivor. A little over 30 years now. My wife is also a cancer survivor as well now, which was unfortunate to happen. But in my work that I've done as well as an independent health insurance agent, I've seen opportunities and ways that we can do things differently and better. Now, the ACA came into play, and we all know that, and I watched clients of mine have health insurance premiums more than double. So out-of-pocket expense and cost of premiums is huge. There are families that I've worked with that before insurance even kicks in are going to have to pay $25,000 to $30,000 out of pocket before the insurance actually kicks in. We have to do something different. Now, the governor has introduced a $200 million plan to help prop up some of those premiums, and I think that's a good starting point.
Okay.
But I think my experience as a person who has a pre-existing condition, as well as a wife that has one, and my insurance background really lend me to find some creative solutions to do things differently, so we have a more patient-doctor focused arrangement in healthcare versus one that seems to be worried about more things than patients and doctors.
Let's stay on this for a couple of more questions.
Sure.
The rural areas, older residents, lower household income than the state average, young leave, more and more healthcare provided by Medicare and Medicaid. Thoughts on how to help with healthcare in the rural areas, sir?
You know, when you look at this as a big picture item, one of the things that has to be done is looking at finding ways to get people into health insurance plans. And Medicaid and Medicare, as we know, historically have not, they've got fixed rates that they're reimbursing for hospitals and doctors. And that puts a real pinch on the hospitals and doctors. And sometimes, you know, we have doctors that don't want to accept patients because of the low reimbursement rates. So the more that we can do to get people into actually true health insurance plans, the better those reimbursement rates are for the providers, and the more likely they are to stay in communities and enhance the services that they offer. Medicare and Medicaid are great programs, and they have to be available for the people that need them, but we have to find ways to make sure that the doctors and hospitals working in those areas are getting paid what they're worth so that they stay in the communities.
Was the Affordable Care Act, on balance, a good thing for the nation in terms of health care?
You know, it really depends on who you talk to. Okay. I think one of the big benefits,
that's a fair answer,
yeah, one of the big benefits of it is covering pre-existing conditions.
Yeah. Okay, final question on health care.
Sure.
Areas where there are shortage of medical professionals, does the state have a role in helping to retain or recruit medical professionals? If so, what's the state role?
I think we do, and I think that has a lot to do with how we make you know, the legislation and the health insurance side of the world and the Badger Care side of the world, how we make those, the reimbursement rates more acceptable to the doctors and the hospitals that are working in them. I think that's how we recruit them. It's unfortunate from my standpoint, some of the things I've gone through, but one of the things that I've seen under the ACA Act that's impacted me, I'm on my 4th primary doctor in about 6 years because they keep leaving the practice.
They do.
And this is in Green Bay. So in the Green Bay metro area. And we need to find ways that they want to stay here. They want to keep practicing medicine. And part of that is making sure that they're compensated for their value. So,
you're a local official. You serve on which board?
I'm on city council for the city of Pere.
Well, as a local official, then, we've had levy limits on local government since 2006.
Yes.
Local officials, this is their terms, some say levy limits strangle their ability to provide local services. Time to ease levy limits or get rid of them?
I say it's time to ease them. I mean, obviously in 4 years on city council, I've experienced the conversations sitting there going, okay, now what do we do? And we find creative ways to make it happen, but I think there's more that our cities could be doing if we had a little bit more flexibility. And so I would say easing them. I don't know that we fully get rid of them, but I say easing the levy limits could be beneficial to many communities, especially those that are handling their finances very well.
Transportation, highway funding impasse in the capital. Mm-hmm. You need roads for your tourists to come to the Second Assembly District.
Yes.
How would you break that funding impasse?
That's a really tough question, and part of the transportation issue I think that's out there is we have three pieces to it. We have the local roads, we have the state roads, and we also have the federal roads, federal highways. And I think those funding sources are a little bit different. We also have the county involved, I should say. And tourism is such an important piece to this part of the state. It's a big benefit to rivers over in that area. I mean, I love that beach, and I want to be able to get there easily. But to break that impasse, I think we have to start with looking at how we're spending the money and making sure that we're spending it correctly and effectively before we look at other revenue sources or increasing taxes. Wisconsin does have one of the highest fuel taxes in the country, and I think we need to make sure that we're spending the money effectively first before we look at new revenue sources.
The buzz in the Capitol about tolling, how do you respond to that?
I'm not a big fan of tolling. I can see where some people would think it's an easy way to generate some income, but having driven across this country and gone through the toll booths and having to dig for change in between the seats or the trucking companies that have to pay them on a continuous basis, tolling's expensive, and I don't know that it's the right answer. I think it's an easy way out instead of looking at how we're spending it first. So instead of trying to create more revenue first, let's make sure we're spending it correctly first.
You're not ready to raise the gas tax or the $75 a year you and I pay on our vehicles, right?
Correct.
Against the backdrop of mass shootings and school shootings, do we need to change gun laws?
No. No, and I've spoken about this at City Council because the topic came up in one of our meetings. I am very much against any kind of gun law changes at this time if we're talking about schools. The first thing we have to do is secure our schools. If we're going to stand and we're going to pontificate about how gun laws are going to save lives in our schools but not do anything to actually secure our schools, then we're not being honest with ourselves in the conversation. So we need to secure our schools first. I have a child that's in the public school system. I want him secure just like every other kid that's there. Secure the schools first, and we can talk about other things later. So
part of the debate over K-12 schools is how much state aid. Are our K-12 public schools getting enough state aid, or do they need significantly more?
See, I think this is another one of the questions similar to transportation. It always comes down to, not necessarily how many dollars we throw at it, but how we spend those dollars. There are school districts that do a great job on how they handle their resources, and they have great schools. West of Pere school system, where my kids are at, is a great school system. My daughter graduated a year ago, and they had a 100% graduation rate. So there are some school districts that are handling their money and their affairs properly, and I think we need to look at those as role models to help other school districts find a way to make sure they're spending their money effectively.
The choice program, the voucher program, has grown dramatically. Milwaukee, Start, and Racine, now statewide. Yep. Do you support it? Would you like it expanded further?
I do support it, and there's a couple of reasons for that, and this kind of goes back to the comment I just made about good school systems. Sometimes families, depending on their situation, aren't living in areas that have good school systems and maybe can't afford to go someplace else to move at that time. But to tell them that their kids have to be trapped in a failing school because there's no other way to handle this, I think is not how we want to treat our next generation. And what we need to do is offer those parents the option to find a better school if they want to do that. And just moving to another school isn't always the answer, per se, but the parent should have the choice. If they're in a failing school system and they can't afford to go someplace else in terms of moving physically, to give them the option to find a school that better fits the needs of their child so their child has a chance for a bright future.
UW system funding, we're in the 6th year of a tuition freeze on resident undergraduate tuition. Yep. Should the freeze be continued into a 7th and 8th year?
I agree it should. When we had a few years back when this was a pretty big topic, and then there was some revelations about the UW system having a fairly largeable size chunk of money in reserves, but still wanted to increase tuition. I understand there's an argument for that, but I also understand that we have students that need to or want to get through college education with as little debt as possible, and one way to do that is to freeze tuition so that it can become more affordable for people to participate in.
Prisons are going to be a big issue in the next budget. We're closing the juvenile prisons. The prison in Waupun and Green Bay were built in the 1800s. Do we need a new state prison?
That's a big question, and I haven't done as much research on this one as I probably should have, but I can understand that there might be a need to build some new prisons, or a new prison, I should say, and I don't have a really solid answer for you on that. I can say from the things that I've read and that I've heard and some of the research that I have done, that it sounds like that's a direction that we should consider pretty seriously. So,
any idea if there is a new prison where it should be built? You want to keep it in Brown County?
That one I'm not sure about. So, I mean, I understand that there's a few communities that would like to have it.
Yes,
and I think that should be on the table, and those discussions should happen. So,
more than $4 billion in state and local tax investments and other incentives to Foxconn. Good public policy?
I think so. I mean, if I would have been in position to vote on this as an assembly rep when it came up, I would have voted in favor of it. Having looked at this proposal with Foxconn and how it's set up, it's structured in a very smart way. Foxconn is not receiving any money unless they meet certain thresholds. So really the gain is for the state to have a very sizable employer that's going to provide a great deal of job growth as well as revenues into the state before they can actually even receive any kind of subsidies through the state. So I think it was a really well thought out plan for how they handled Foxconn in the subsidies.
And had you been in the assembly, you would have voted for it?
I would have voted for it, yes.
Position on medical marijuana and potentially legalizing recreational use?
Well, medical marijuana is kind of an interesting one because back during my treatments, medical marijuana was something that was offered to me. This was back in the late 80s, and it has to do with the nausea and medications that were not effective for me during my chemotherapy. So it was an option that was made available. I actually turned it down. I wanted to go as drug-free as I could through chemo treatments, which is not necessarily the smartest thing to do. But I think there are some uses for medical marijuana, and I've known people that have used it effectively, and I think that there's some benefit to it. Obviously, it's prescribed by a doctor, managed by a doctor, so I think that's the value in that. As far as recreational marijuana, I'm not a supporter of recreational marijuana. I still think that recreational marijuana, or marijuana in general that way, is still a gateway drug. It may not be for everybody, but for the people that it is a gateway to, giving them that option to pursue it, I think is not a benefit to them, which kind of leads into the opioid epidemic. So
yeah,
I think they can tie hand
We've passed a number of bills on the opioid, methamphetamine, and heroin epidemic.
Yep.
Potential next steps that the state should take?
I think we have to take a much closer look at the people that are prescribing the drugs. Those providers need to do a better job of managing how those prescriptions are going out. I have been with veterans who are prescribed medications because of injuries that they received while serving our country, and to watch them go from an outgoing, talkative, energetic person, the alarm goes off, they take the meds, and a complete zombie. That can't be the right way to handle a person who has issues, from pain to PTSD, whatever it might be. And the fact that we're overprescribing in those situations, it breaks my heart to watch it happen. And so part of it has to do, we have to sit down and find a way to convince providers that just overprescribing is not the answer. Then additionally, those people that have been overprescribed, we have to do whatever we can to help them kick the habit. It's in our best interest to make sure that they are drug-free, pain-free, and productive members of our society, especially the veterans that are going through it. So,
maybe final question, do you want to highlight differences between you and your opponent in the August 14th primary?
I think that one of the biggest differences, and I really don't know my opponent overly well, I've met him a few times over the past couple of months, but one of the biggest differences, I think, is the fact that I've been a steadfast conservative my entire life. I've never wavered from that. I've always supported those core beliefs that we have in terms of protecting the Second Amendment, the right to life, controlling government, those types of things. I've never taken an opportunity to run for office other than as a Republican. although in city government it's nonpartisan, but my conservative beliefs come out quite a bit in our conversations at City Council. In addition to that, just my business background and my leadership background, and being able to work with other people, diverse backgrounds, diverse belief systems, and finding ways to come to a common understanding and a common solution, and moving that forward. Because at the end of the day, it really is about serving the people of the 2nd Assembly District and helping do things in a way that makes their lives better, more enjoyable, and a brighter future for their kids.
Thank you. Dean Raasch of De Pere is a Republican candidate in the 2nd Assembly District. The primary is August 14th. Dean, thank you for talking to WisconsinEye.
Thank you very much. I appreciate it.
Thanks.